Okay, guys, sorry I cut off. Like I said, I'm new to this. So anyways, I got them to put me on the heart monitor, and they only wanted me to wear it like, I think a week. And I was like, you know what? I'm gonna wear it longer than what they want me to wear it because they need to catch this. So I wore it for maybe like 15, 16 days or even a couple days more. And sure enough, I did that and sent it in and had to wait 2 weeks. Well, during those times that I had the monitor on, my heart rate was going crazy. And, you know, it was scary, of course, you know, and I'm just so glad it got caught. So finally, I go talk to my doctor about the results. And they're like, oh, well, we're seeing that you had some SVT, supraventricular tachycardia episodes. Well, no, guys, there's different types of SVT. I mean, you can have SVT, but there's just different kinds, right? So I'm like, oh, okay. Whoa, yeah, see? So I don't have anxiety. Well, I do have anxiety, but it's not my anxiety causing my fast heart rate. So, okay, that was that conversation. They kind of like felt stupid, I think. So in the meantime, I was already reaching out to Stanford, which here in California is supposed to be one of the best hospitals. And I had an upcoming appointment with the cardiologist in Stanford. So I got there, and he's just kind of, you know, talking to me, breaking the ice and stuff like that, because I have seen him one time before. And it's very hard to get into Stanford, so I do feel blessed that I finally did. But it was like after years of pleading and crying and like begging, you know, doctors to take me serious. And yeah. So we were sitting down and talking. He's like, okay, you do have atrial tachycardia, which is a form of SVT. And what that is there's another electrical pathway making my heart go fast. But then on top of that, I have what is called normal sinus rhythm tachycardia, where my heart is just going really, really fast. And he's like, you know, that can be brought on by pain or stress. And hey, if any of you guys have another health problem, I do have health problems, you know, fibromyalgia and migraines, and, you know, I can go on and on. So he's like, those ones we're not going to be too worried about because your heart can go fast. You know, you can get on a treadmill and pump your heart up to 180 and you'll be fine. So that's kind of all he told me with that. As far as me getting an ablation right now, it's out of the question, he said, because it's a risky surgery. And, you know, you go on all these places and look things up and everybody makes it sound like it's so non-risky and so easy to have done. So, no. Anyways, to this video, I'm going to end it because I have so many other things, and I'll get back on and do another one until I can help somebody understand. I don't care who it is, even one person. The moral to this video is this. 4 years, every time I went to the hospital, every time I called the doctor, every time the ambulance was here, and believe me, they were here every other day for 4 years, I was told I had anxiety. Yes, which is true. But I was told the only reason my heart was going fast is because I was having anxiety attacks. But I wasn't. So if I can help anybody out with this video and tell you this, you're not crazy, you know your body, and if you know the difference between your regular anxiety and this, and you feel that there's something wrong, keep fighting. Keep fighting because there's hope. Because you know what? I did, and I at least finally have a true diagnosis, a true answer, but a long road ahead of me. And I guess I'll get back to that on the next video. So subscribe because it's important to me. This is actually something I'm trying to do for myself too, to keep my mind off of it and help me get through life because it's been pretty hard. So the more people I have to talk to or tell me their problems or that I can help or whatever, it means a lot to me. So subscribe to me, and I'll be back real quick.